Hello, this is Dr. James Murtaugh again. I want to thank all our referring doctors out in Cincinnati. Many of my doctors have been asking, when should we refer a patient with a sleep disorder to the sleep clinic? It's actually pretty easy, and we'd like to help you. We prepared some materials that we're going to distribute, and we'd love to help you in any way that can screen for sleep apnea, for instance, quite easily. We call it the STOP exam. Now, there are just 4 or 5 questions you need to ask, and we put them on cards that we're going to give to you that you can use in your evaluation of patients, or just put it out in your waiting room. The patient can fill out, or you can just make it part of your initial questionnaire. But the main questions are: stop. Does the patient snore? Is the patient tired? Has he ever been observed to stop breathing? And does the patient have a blood pressure problem? And then there's a 5th question, which is, does the patient have a neck greater than 17 inches? These questions are highly related to sleep apnea. If even one of these questions are positive, there's more than a 70% chance of sleep apnea. If 2 are positive, then the patient almost certainly has sleep apnea. So with this very simple screening device, you can easily tell which patient should come to us for a polysomnogram, and we'll be happy to help you in any way. As all doctors are becoming aware, sleep apnea affects the heart, affects the endocrine system, diabetes, obesity. When you don't breathe well at night, a lot of systems in your body don't work well. So many of our cardiologists are realizing if somebody has atrial fibrillation, they really need a sleep study to exclude sleep apnea as the cause of the problem. If a patient has resistant hypertension, that alone can be enough. And I'm glad to say we're having a lot of good results. Now, the STOP exam is easy, and it is for screening for one kind of sleep disorder, sleep apnea. That is not the whole story. Here at Sleep Care, we're undergoing a renaissance. We want to take care of the total wellness of your patients. And that doesn't necessarily mean CPAP. If you look at sleep disorders, about 1/3 are sleep apnea, 1/3 are insomnia, and 1/3 are restless legs. Now there's 88 other conditions as well. We have programs now to take care of all sleep disorders. We want to see your patients for jet lag, for circadian rhythm differences, for shift work. All of these can cause disturbances in sleep. Insomnia is about 58% of the U.S. population. We don't have a very simple exam for insomnia, but you as clinicians know if somebody just isn't sleeping well, if somebody is a perfectionist. I think we all know that sleep apnea is more common in the man, but insomnia is more common in the woman. Women's work, there's the saying about men work from sun to sun, but a woman's work is never done. Women tend to worry more at night and have a lot of thoughts interfering with their sleep. In these times of economic uncertainty, there's lots of worry. There are programs that help insomnia, and we're instituting cognitive behavioral therapy, feedback, biofeedback, sleep restriction, and these programs are highly effective in helping insomnia patients get to sleep. We now have a referral system for the total wellness of the patient. We can help patients sleep by promoting a healthy lifestyle, weight loss reduction, athletic training, diabetic counseling, smoking cessation. We want to work with you to help your patients achieve better success in life. And better success in life depends on better sleep. So, in summary, in screening for any disorder, you have to be suspicious. Sleep disorders affect a huge portion of the population, and really you need to consider it in most of the patients that you're seeing. If you suspect somebody might have sleep apnea, you can screen easily in your office using the stop exam materials, and we'll be glad to get them to you. And also we have a website with the stop exam. If you think a patient has insomnia, again, that's 58% of the population. We're happy to see them. In fact, we would be pleased to see any of your problems that are having a sleep disorder of any kind. Given that the prevalence of sleep disorders are so high, many patients will have 2, 3, or 4 different sleep disorders, and we have to attack all of them using everything at our disposal. I mean, there's a lot of science in sleep. I think we all know that science is exploding in sleep, but there's also the art of sleep. And we're mastering both here at Sleep Care, and with your help, the referring physician, we want to get sleep education to all the patients out there. Despite everything we know about sleep disorders, 90% of the people who need sleep disorders treatment are not getting treated. People with sleep disorders who do not get treated have a lifespan 20 years shorter than those who do get treated. People who are treated have a dramatic decrease in their overall cost of medical care, because in many cases we can reduce some of their other medications, hypertension pills, depression pills. We're going to use everything at our disposal to make the management of your patient easier, and sleep really is the key to good health. If you have any questions on the best way to screen patients, please don't hesitate to call me. I'm more than happy to come out and talk to you. We have our Sleep Care sleep coaches who can come out, and I think it's relatively easy to know how to screen for sleep disorders, and we're glad to help you. And again, I just want to thank all of you for your referrals. We at Sleep Care take it very seriously and are very grateful. Thanks very much.